This is Tacoa Rogers, FNP, dictating a doctor's office visit note for Elizabeth Mansfield, FNP, for patient RL. The PCP is Elizabeth Mansfield, FNP, and the date of visit is November 6, 2019. Chief complaint: I'm here for my regular checkup for my blood pressure and diabetes. HPI: Mrs. RL is a 78-year-old female presenting for follow-up and maintenance of chronic hypertension and diabetes mellitus type 2. Past medical history: she denies having any surgeries. Her medical history includes diabetes, hypertension, acid reflux, and hypothyroidism. Her allergies include codeine and lisinopril with no listed reaction. Her current medications are levothyroxine, 75 micrograms by mouth daily, Dexilant, 60 milligrams by mouth daily, Lipitor, 40 milligrams by mouth daily, metformin, 500 milligrams, 1.5 tabs by mouth daily, enteric-coated aspirin, 81 milligrams by mouth daily, levocetirizine, 5 milligrams by mouth daily, ibandronate, 150 milligrams by mouth monthly, and dicyclamine, 10 milligrams, 2 caps by mouth 4 times a day. Her immunizations are up to date. Social history: the patient is single and lives with her son. She is retired from retail and denies smoking, alcohol, or drug use. She states that she lives a sedentary lifestyle and does not exercise, but makes sure that she eats the right diet. Family history: her mother and father are both deceased. She has 4 brothers and 5 sisters, all living. Some have diabetes and some have hypertension. She has 2 sons and 1 daughter, and 1 son has hypertension. The other son and daughter are in good health. Review of systems: she denies fever or chills and states that she does have some tingling in her hands and feet that is off and on but not constant. HEENT: she denies cough or sneezing, denies congestion, denies itchy watery eyes, denies headaches. She denies any vision loss, blurred vision, or ringing in the ears, and she denies any drainage from her eyes or ears. Respiratory: she denies shortness of breath or wheezing. Cardiovascular: she denies palpitations, denies any chest pain, syncope, or heart murmurs. GI: she denies any loss of appetite, denies nausea, vomiting, and denies any changes in her bowel habits. GU: she denies any dysuria, burning, or pain. Musculoskeletal: she denies muscle cramps, denies any muscle soreness, and denies gait disturbances. Skin and breast: she denies hair loss or any changes to moles, and she also denies any lumps or tenderness or swelling or changes to her breast. Endo: she denies any numbness or tingling to the extremities. Hematologic: she denies any anemia, denies any excessive bruising or varicose veins, and she also denies any pain or swelling to her lymph nodes. Neuro: she denies any convulsions or history of epilepsy. Psych: she denies feelings of depression and denies any suicidal thoughts. During the objective assessment, her blood pressure is 116/52, heart rate is 80, her temperature is 98.0 orally, her respiratory rate is 18, her oxygen saturation is 98% on room air, her height is 65 inches, her weight is 187.2 pounds, and her BMI is 31.15. Mrs. RL is an alert, well-nourished, and well-groomed adult female. She is appropriately dressed and is friendly and cooperative. She is also well-spoken and well-oriented. HEENT: her head is normocephalic, her eyes are symmetric in size, shape, color, and position. Her conjunctiva is clear. There are no deformities noted to her nose, eyes, or ears. Her nasal mucosa is pink and moist. There's no drainage noted. Her ear canals are clear and the drums are intact without bulging, and the tympanic membranes are pearly gray, and her throat is pink and moist. Neck: the trachea is midline and mobile. Her carotid pulses are bounding, and there are no crepitations with neck movements. Cardiovascular: S1 and S2 are heard without any signs of murmurs. There are no diastolic sounds. Her pulse rate is regular at a rate of 80 beats per minute, and there are no gallops or rubs heard. Respiratory: on auscultation, the lung sounds are clear bilaterally to the upper and lower lobes. The chest is symmetric, and her respiratory movements are even and non-labored with a respiratory rate of 18 per minute. GI: on auscultation, her bowel sounds are normal and heard in all 4 quadrants, and her abdomen is soft and non-tender. GU, her bladder is non-distended and non-tender. Musculoskeletal, she has full range of motion to all of her extremities. There are no crepitations on joint movements, and there are no deformities noted and no edema to the extremities. The skin is warm to touch with no rashes and no bruising noted. Endo, she has a normal sensation to her feet noted bilaterally with monofilament, and no lesions or abnormalities are noted to the feet. Psych, she answers questions appropriately and she denies any suicidal or homicidal thoughts or ideations. Labs, her fasting glucose finger stick is 191 and her hemoglobin A1C is 7.7. For a diagnosis, we are diagnosing her with diabetes type 2. She has diabetes that is chronic and that is without complications on today. Although her glucose finger stick is 191 and her hemoglobin AC is 7.7, we educated the patient on her glucose levels and the reference ranges and instructed her that her A1C is suggested to be below 7. For her plan, we're going to increase her metformin to 500 milligrams, 2 tabs a day by mouth daily, and hopefully that will decrease the A1C and also get the blood fasting glucose under control. She is also to continue all of her current home medications as well. She is to follow up in the office in 3 months for a reevaluation of the medication increase of her metformin and its effects on her blood glucose levels.